What I was going to print, because I got this. It's under recent.
Can y'all hear me back there? Can you hear me? I'm so loud. You can hear us.
Please use the mic. Use the mic.
Please use the mic. Step out of your
Oh,
comfort zone.
these for some reason just make me really uncomfortable.
Step out.
I know. Okay, out of my comfort zone. Okay, has everybody got your kits?
Yes.
Have y'all started using them yet?
Yes.
And what's your response? Okay, so we've been here all day, and I was sitting back thinking, you know, we're all asking the experts, we're all trying to figure out new ways to separate ourselves from our competition, and they're sitting right here. They're sitting right here. These are a game changer. They are us showing our doctors what we do different when you walk into an office, and you can say, hey doc, we come in, we ask you for the business all the time, right? But this is a way that we can partner with you. This is a change, this is a difference that an agency we are investing in for the better all of your patient, right? So I wanted to share with y'all a little deal. Amber and I did a co-marketing event at a, we did a presentation at a private duty company last Friday. We kind of co-presented both the CHF and COPD kits at the same time, which we'll do for y'all today. We walked out an hour later, they called us with 2 patients.
Family members. They were family members of people that work there.
So this is a game changer. This is an opportunity for you to be able to walk in. Maybe for the ones that are brand new, that really you want to become the expert. It's so easy because everything is right here and you can walk through it and just show the differences. They're huge. The ones that are maybe tenured AEs, maybe you have a relationship with some accounts and you've gone through all of our programs and you want to do something different. This is the way to do that as well. Okay. So I'll just give you all the presentation. You can make this as short if you make it your own, but I'll give you the presentation we did the other day. Hi, my name is Blair. This is Amber. We're with Total Home Health. We have the privilege of being a privately owned company. Our owner actually lives in the community where we serve our seniors every day. We have a privilege of doing that. Today we really wanted to take some time and talk to you guys about the steps that we take at Total across our entire company to help drive down preventable hospitalizations and specifically your CHF and your COPD patients. I'd like to show you the proof before I talk to you, Dr. Bergen. Are you familiar with the CHF and COPD, the hospital admission rates right now, the focus on Medicare admissions? And what are you doing for your office to drive down that number for your patients?
I'm trying to
Keep them compliant. At Total Home Health, third quarter this quarter, for our CHF alone, our readmission rate was only 10.8% versus the national average of 25%. So there's 2 ways that we do that, Doc. I want to talk to you about them today. The first way that we do that, thank you, ma'am, is we've actually invested in these kits. These kits are for any of your newly diagnosed or unstable meaning they've had a recent hospitalization or ER visit. And we bring these to them. In here, there's a lot of wonderful information and tools to help them activate themselves to manage their disease at home, Doc. There's a digital scale. How many of your patients don't even have a scale at home? How many of them, right? How do they manage their CHF? How do they do that? How do they do that if they don't even have a scale? We also give them a blood pressure cuff. It's a huge thing, right? There's also a med planner that our nurse, whenever we go out, we can do some medication management with them, help them sit down and look through all their meds, make sure they're taking them correctly, they're not scoring them. It's also an input and output just cup for them as well. We know that intake and output is a huge thing with a CHF patient, right? So how often do you get to your office on a Monday morning and you've heard from your nurses that one of your patients has either had an ER visit or a hospital stay? Every Monday. And what happens from that?
My phone is ringing off.
Okay. Do you have one person in charge of it? Okay. So another thing that we do is if you have that patient, those that are frequent flyers, we want you to entrust Total with them, okay? We can be a clinical partner for you. And when I say that, I mean that there are a lot of our information in the education pieces in here. there's a log, and in the log, we can say, okay, Mr. Smith, you're newly diagnosed CHF, you've already gone to the emergency room once. We really want you to start logging and recording your weight at least 3 times a day. Our clinician will go in and sit down with that patient and really instruct them on how to manage that. You can say, okay, if he's gained over 3 pounds overnight, our nurse will look at that, right? We go and we're looking at their log, and they bring it into you once a month. They show you that log and everything they've written down. So it helps them to manage their disease. You understand? Awesome. We also front load our visits. So we can do this from the hospital, which is a huge impact. We also do it from the office. So what that means is for the first 7 days, the RN's going to see them for the first 3 days. For the next 4 days, the same LVN is going to go out to that patient's home. So if you had a patient that's had a hospitalization, we know there's a critical 10-day window that they're going to have the most susceptibility to be readmitted back into the hospital. So for 7 consecutive days, Doc, we're going to see that patient. Is there another agency that you know that does that? Absolutely not. I'm going to pass this on to Amber. She's going to talk about COPD to you.
Appreciate your time, Dr. Bergen. I want you to think about when your nurses go out to that waiting room and they call a patient. How many patients do you have that get from the waiting room to the exam room and they're out of breath? You can think of some right now, right? What we do at Total Home Health, just like we have our CHF kit, is we have a COPD kit. And we are also focusing on preventable hospitalizations. We want to keep your patients out of the hospital. We want to be a clinical partner for you. So what's in our COPD kit is a pulse oximeter, so your patients can take their O2 saturation rates. There's a peak flow meter, so they can see how much CO2 they're getting off of their lungs. There is I like to call this an energy conservation tool. It's like a medicine bottle opener. They can open different things because at Total Home Health, we understand that energy conservation is so important with your COPD patients because they take so much energy just to breathe. Doc, we also have a med planner and we have patient education. If you have a patient that is newly diagnosed COPD or they've had several exacerbations, they're unstable, we want to activate this patient. We want to give them a tool to help manage and have some control over what's happening with them. By front loading our visits, we're going to send an RN out for the first 3 days, and we're going to activate that patient and say, it's important to take your O2 saturation. It's important. This is how you do pursed lip breathing, which is in our kit. We also have this little handy dandy magnet thing that you can put on your the refrigerator. And what it does, it says, okay, if this is what you're having trouble with, you're in the green zone, maybe it's going to prevent some anxiety for those patients because you know what? If you take a coffee stirrer straw and you breathe through it, that's what it feels like to be a COPD patient. And so when I did that in my office one day, we were having an in-service like this, I had anxiety and I know I can breathe just fine. What we want to do is we want to be that contact. You said your phone's blowing up with COPD patients that are calling in, right? We want to be that contact, that arm inside that patient's home. So the first 3 days an RN is going to go out, the next 3 days an LVN is going to go out, and we are going to get these patients in the habit of logging their O2 saturation rates, understanding what's going on, and maybe activating them in being a, partner in treating what they have. Also, one thing that we do, how many of your COPD patients have maybe a nebulizer or a metered dose inhaler? Most of them. Okay, way back in the olden days, when dinosaurs roamed the earth, DMEs used to send a respiratory therapist out to explain what a nebulizer was, correct? Well, now we know there's cuts everywhere. I mean, you know it, I know it, we're experiencing all over in medical industry. Let Total Home Health go out and educate your patients on one, what are they taking in that nebulizer? Is it going to make them a little shaky? Is it going to make them a little anxious? The metered dose inhaler, are they using the spacer rule and putting it 2 fingers out from their mouth and getting the most medicine for their breath? Also, from an infectious disease standpoint, we can go out and make sure they know how to clean that nebulizer so your patients aren't reinfecting themselves. Doc, do you know of any other home health that's going to be a clinical partner for you? And we invested in these kits. They're no cost to your patient. When they come off of our service, they get to keep the kit. Because we care about your patients and we care about the seniors we treat. So, Doc, is there an opportunity of a patient that you can think of that just probably left your office, that was out of breath when they left, that had COPD, that will give us the opportunity to show you what we can do at Total Home Health? Dr. Burden, give me the patient.
Dr. Burden. Good job, ladies. It's never easy to do role play, especially in front of a room of 55. But I know it's easier to do it in front of your docs, right, than it is in front of your peers. Thank you. Good job. Now, I want to address this because I don't want there to be any rumblings in the room. I don't want AEs whispering to each other going, ooh, what they said is not exactly how we do it in our office. We don't go see a patient for the first 3 days with the same RN, and we don't go see the patient the next 4 days or the next 3 days with the same LVN. There may be some variances in our offices, folks. We're just launching this. We're getting the clinical pathways written, okay? When the clinical pathway is written, it will be standardized across the company. Every office will clinically operate exactly the same way. That is critical. Who's responsible? Who's going to write that clinical path? Who owns that? Kay. All right, Kay. Kay's got it. You see the lady right there? Stand up, Kay. This is the woman. And so it's really important. It is important so that we're all delivering the same message. Right? Thanks a million for getting that done, Kay. So that'll be a clinical path for both our CHF and our COPD. Thank you, Blair. Thank you, Amber. Thank you, Amy, Dr. Bergen. Yes, thank you, Dr. Bergen. Julian. He's on a mission? Well, I need Julian to turn on the projector for me. And anybody that didn't vote, you need to do it now. In fact, if you need to vote, hand the votes to John because he's already pre-counted, so whatever vote, put them off to the side. Fold it in half, put it off to the side. So John, I'm going to give this to you and just add.
Can make it through.
Maybe
Wide awake. I mean, from here down, my body was like going, would you just go to sleep? Oh my God, would you just go to sleep? My eyes were closed and my brain was going, sounded like a bunch of squirrels fighting in my ear.
All right, get your voting done.
2 o'clock, I put the TV on. And I'm like, out of the room earlier, but I went to the room, I went to the main breakfast room. He said to come in here. What is it here? I'm here, I'm shaking. So then the lady said, thank you. And I was half asleep.
Yeah.
She's 80. I'm like, why are they expecting her?
We're related. That's my
All right, John, do you have it all? Just do a final count. You can whisper in my ear. Would you mind? I'll get John to do it. I'll read it. Even